clots. Clots form in your heart. Damage to the lining of the arteries causes clots to form, and those clots can either get dissolved, which often happens, or they can get organized. And organized is like forming scar tissue. So those clots become like scars, and they gather like calcium. So people get calcium deposits. They thicken the arteries, so the arteries aren't as pliable as they used to be, so blood doesn't flow as well. And then those scars diminish the area of the blood vessels so that there's less blood flow getting to the muscle. So for all those reasons, atherosclerosis is a big problem, and that's coronary artery disease or coronary heart disease. So how do you stop the clotting? Inflammation increases your risk of clotting, and that's a really important thing. So if you have chronic inflammation from a lot of different sources, you could have type 2 diabetes increases inflammation. Having extra fat on your body increases inflammation. Having chronic infections increases your inflammation. They did a study once on the relationship between gum disease and heart disease. And guess what? There is a good correlation. Like more gum disease, more heart disease, more gum disease, more heart disease. What the heck? Why would that be? What would your gums have to do with your heart? Inflammation. As you're increasing the inflammation in your body, you're increasing heart disease. So it's important to stop those clots from forming. That's where the inflammation does. It makes more clots. Now, there's another side to that, and that is, if you make clots, you should be able to just dissolve them and have a normal artery, and everything dissolves and fixes, and it's all good, right? Why does it form scar tissue in there? Why doesn't it just dissolve and make a new artery like normal? Why doesn't it repair properly? Because it can't. If it could, it would. And there's a lot of different reasons why. The main reason is stress.